The interplay between hormonal fluctuations and athletic performance in female athletes remains still to this day a very critically underexplored sort of frontier in sports science. Despite the increasing participation of women in high intensity training modalities such as CrossFit or High Rocks, much of the foundational exercise physiology and sports nutrition literature really has been developed around male physiology. However, it is now becoming way more established that the menstrual cycle exerts meaningful phase-specific effects on physical, cognitive, and emotional performance, particularly through the actions of estrogen and progesterone on things like pain perception, thermoregulation, carbohydrate and fatty acid substrate metabolism, neuromuscular coordination, and central fatigue. In the follicular phase, which would be the first approximately 14 days of a woman's cycle, which is characterized by rising estrogen and lower progesterone, female athletes often experienced enhanced endurance capacity, improved glucose utilization, and better mood stability. Conversely, during the luteal and premenstrual phase, or sometimes called the late luteal phase, where progesterone is elevated relative to estrogen, that phase or those phases are often associated with increased fatigue, greater inflammation, mood disturbances, impaired neuromuscular control, and a higher susceptibility to exercise-induced muscle damage. These symptoms are often further exacerbated in athletes with what we call full-blown premenstrual cycle, often just simply abbreviated to PMS, which can significantly diminish training consistency and performance output. Efforts to really mitigate these impairments have historically centered on pharmacological solutions or cycle-specific training adjustments. However, recent attention has turned towards non-pharmacological nutrition-based interventions. One promising candidate that we're going to talk about today is dark chocolate, which is a functional food that's really rich in things like flavonols, polyphenols, magnesium, and theobromine. These bioactive compounds have been shown in other studies that we're not going to talk about today to exert anti-inflammatory, antioxidant, analgesic, which basically means pain reducing, and neurocognitive enhancing effects. Preclinical and clinical data suggests that flavonols from cocoa can modulate endothelial nitric oxide synthase activity, which is sort of a key compound in generating nitric oxide, which definitely helps with performance. Also, they can enhance cerebral blood flow, reduce oxidative stress markers like C-reactive protein, interleukin 6, and TNF-alpha, which are also common things that are produced by the immune system. And they can influence mood and cognition via central neurotransmitter pathways as well. Next, dark chocolate also provides a lot of magnesium, which is a micronutrient that is often depleted during menstruation and exercise, and it has been known to modulate muscle contractility and central fatigue. These overarching mechanisms really might be particularly or extra relevant for supporting performance sustainability and post-exercise recovery. So while dark chocolate has been studied for its effects on vascular health, metabolic efficiency, menstrual pain, little is really known about its capacity to influence sport-specific performance and really cognitive metrics across the menstrual cycle in well-trained populations. So to address this gap, the study that we're going to talk about today, seen here, employed a randomized, double-blind, placebo-controlled crossover design, which is basically the gold standard, trying to assess whether acute 85% dark chocolate supplementation could enhance functional performance, cognitive processing speed, and reduce delayed onset muscle soreness, often abbreviated as DOMS, across 4 different defined menstrual phases in trained female CrossFit athletes. 15 eumenoric athletes, which basically just means they had a normal cycle, were assessed in their 4 menstrual phases. So menstrual, follicular, luteal, and premenstrual. And they did this under 3 conditions. One, where they had dark chocolate, 30 grams per day for 3 days. A placebo, which was calorie matched, low cocoa chocolate. So basically trying to make something that looks and somewhat tastes like chocolate, but doesn't actually have the same chemical properties. So they're trying to get the closest control that they possibly can. And then knowing that that might be a little bit imperfect, they just had a no intervention control as well. So a couple of controls in there. Performance was evaluated via the workout Cindy, which many of you are probably familiar with, 20-minute workout of 5 pull-ups, 10 push-ups, 15 air squats. They also did a hand grip strength test, and then something called a Stroop test, which we'll talk a little bit more later. And then DOMS was tracked for 72 hours post-exercise. What they found is the following. For the Cindy workout, they found that the participants improved significantly with dark chocolate, particularly during the premenstrual phase, suggesting mitigation of cycle-induced decreases in neuromuscular efficiency. When they looked at cognitive performance, specifically reaction time, this was also seen to be enhanced during the premenstrual phase with dark chocolate, both versus placebo and that control chocolate that I was talking about before. DOMS was also significantly attenuated in the luteal phase, which I thought was really interesting. This implicates a possible interaction between dark chocolate's anti-inflammatory, the polyphenol compound specifically in there, and progesterone-mediated inflammatory sensitivity. So no meaningful changes were involved in isometric strength, indicating basically the effects of dark chocolate really were specific to metabolic endurance and maybe more so cognitive domains, not sort of like maximal voluntary contraction. One really important thing that I forgot to mention about the study till now is that the dark chocolate and the placebo groups were matched for their energy intake and macronutrients across the study. So they're basically trying to say, like, we're not just giving people more calories, because if you did that, especially in sort of the premenstrual phase, that in and of itself has been shown to enhance performance. And in fact, something that I do with my clients is to help bump their caloric intake, specifically their carbs and their fat, in the week leading into their cycle for exactly that reason. So that was a really nice control that these guys did here in this study. I think the data overall supports the concept of using a short-term, high cocoa dark chocolate supplementation strategy to basically use a non-pharmacological intervention to try to buffer menstrual cycle related impairments if you're training with high intensity, functionally relevant tasks and need to use some cognitive capacity as well. The effect appears to be phase specific, with the most robust benefits being observed during hormonally challenging phases. So during PMS, and during the luteal and late luteal phases. I do have a few criticisms of the study. The first off is that the sample size is really small at 15. Ironically, they started by looking at 50 total women, but 35 of them didn't actually have relative cycles, which is interesting sort of unto itself. Like, why was that so high in this CrossFit demographic that so many women had dysregulated menstrual cycles? Secondly, it would have been nice to see some hormonal verification. Menstrual phase classification relied on basically a questionnaire and basal body temperature tracking, which are standard methods, but there was no sort of biochemical verification looking at estrogen and progesterone levels. They also really didn't do any biomarker tracking. So they didn't look at like creatine kinase, interleukin 6, or other inflammatory markers. They didn't look at cortisol. They didn't look at neurotropic factors. So that would have been a nice thing to add to the study as well. As far as real world, sort of practical takeaways for female CrossFit athletes, I think the study provides compelling phase-specific evidence that short-term dark chocolate supplementation can really enhance functional performance and cognitive speed while reducing muscle soreness during, phases of the menstrual cycle that are hormonally challenging, right? So for athletes that are really trying to optimize training outcomes across the month, I think the findings support a few strategies. First is that you should use high cocoa dark chocolate around the time that you are generally going to suffer from PMS-related symptoms. So you would use, according to this study, 30 grams of 85% dark chocolate per day for 3 to 4 days leading up to and throughout the phase that you experience PMS. Importantly, like as I just said, you want to choose the right chocolate. It needs to be 85% dark or more, which, just to be clear, is not super tasty. Like 100% dark chocolate is actually rather unenjoyable. You can find some 85% that's pretty good, but like this isn't going to be something that's going to be earth-shatteringly good like many people are thinking. I think the other thing that's important that is a takeaway from this study is that you need to track your cycle. Implementing this strategy effectively requires understanding your own menstrual cycle phases. So you can use, publicly available apps out there like Clue, Flow, or just manually track your cycle length using basal body temperature as well to try to make sure you know where you are in your cycle. So in summary, I love this study. For female athletes out there, integrating 3 to 4 days of high quality dark chocolate into your diet and into your macros makes a lot of logical sense based upon this. It's also great to see the field recognize that there really are impacts of the menstrual cycle on your ability to train and perform at high intensity. Hopefully more studies will come out to support women and give them strategies to work around these issues in the future.